see that the main reason is the presence of the Seventh-day Adventists in Southern Province, who have made it clear that smoking is a sin. And I think I've spoken at one SDA youth rally about smoking. And well, the church is doing something there. And is there no church in Western Province? There is, okay? But then there's so much going on in terms of smoking. And Kasonde will be happy to know that number 2 on that smoking league is Eastern Province. But nevertheless, my main reason for accepting to speak is that we, as a church, are not making healthcare a priority. It is not. I come from Lusaka Baptist Church. I'm sure you know it's the biggest Baptist church right now. But when we have our youth camps, we have to struggle to find a nurse to be at the camp because there are so few of them, okay? We have to struggle to get a doctor who could be available to be at the camp. Why? Because there are so few of them. And when you look at the whole church to see how many are training to become health workers now, it's such a small number. And you're wondering what exactly is going on. When I ask around, they all tell me, oh, well, no, health is really not a profession to go into right now. Okay? They have all sorts of reasons. But there's fancy now for accountancy. There's a lot of them who want to do law. There's a lot of them. And I'm wondering what exactly is the church up to? Because for me, the church must be in the fore when it comes to health care. And I think in my bio, I did try to put in, I put in the issue of being a visiting physician to Mother Teresa Hospice. It was not deliberate. One of our church members got discharged from the hospital, and I should thank the elders at Lusaka Baptist Church for having located him. You know, he just disappeared from church and we were wondering where he was. The man was actually in very bad shape at his home somewhere. So the elders arranged for an ambulance to pick him up from there. He was brought into St. John's and we looked after him. Then we discharged him from St. John's. Now the question is, where does he go? Okay? And the people who went to pick him up from home, they said, this man only has a house. It's just a shell of a house where he's coming from. The wife left with everything. And there's no one among his relatives who is able to look after him. Why? Because he had developed some mental illness. And so in his mental illness, his relatives were the largest enemies. And so he had actually insulted every one of them. And no one wanted to take him in. Where does he go? Okay? And then someone said, well, let's take him to the hospice. So we said, well, let's go and see what this hospice is about. And so we had to get into Kalingalinga, and surely we found a gate there written Mother Teresa. The guard opened for us. We went inside there. It was a whole compound. At that time, they were looking after, I think, some 120 children from newborn to around 12 years of age. They had about 80 women admitted there, and another 130, 140 men admitted. Asked who is looking after these people? Nuns, 7 Catholic sisters. Do you have any doctor among you? 0. Any nurse among you? 0. Okay? And they say, we've been looking for someone to come and help out. And there's nobody, really. And the Mother Teresa nurses are there for what we call palliative care, for end-of-life care. So you go to Mother Teresa when you know my life is done now, I want to die, and I want to die in a place where, you know, I will be at peace and someone will actually be talking nicely to me about heaven and things like that. But were all those people dying? The answer is no. Those people were desperate for health care. And so the church was trying to answer to their needs. And so when I was asked, come with this, there's a talk on health care, I said, well, I must be there because I need to try and voice out what is on my heart. And I think it was yesterday when I was looking at my topic again, say, what exactly am I supposed to talk about? And the question I'm trying to answer is, how has the Evangelical Church been the light in health care? So I called you, brother, I said, Evangelical Church, who are you calling evangelical? But well, I hope at the end of my talk, we can agree together on who this Evangelical Church is supposed to be. And I was really looking forward to having a lot more young people here so that we could interest them in the journey of caring. And I can see that most of us who are here have already spent our career, so to say. We are all preparing for retirement. But really, I'm hoping that the young people will catch most of what is being live streamed, or later on they can catch up with our talks so that they know that actually healthcare is a core profession for a Christian. Now, I will first of all talk about how the New Testament church responded to the call of their Christian confession, so to say. And I was trying to say, which of the writers am I going to quote? And I had to avoid quoting from Luke, because everyone will say, oh yeah, a doctor is quoting another doctor. So I'm quoting from Matthew, the accountant, the tax collector. Matthew, as he introduces the ministry of our Lord Jesus Christ, talks of him starting his ministry, preaching and healing. Matthew chapter 4, that's where we start from. Very, very early in the ministry of Jesus Christ. And I really think that, the Apostle Paul says, imitate me as I imitate Christ. And that ought to be the life of every Christian, to imitate Christ. Two main things that Christ himself did are the two main things that a Christian must do: preaching the word and healing or caring for those who are in need. And I also liked the way the Gospels put it about the ministry of Christ, that he treated all kinds of illnesses, all kinds of sickness. And that, I think, is what we ought to be looking up to. And when you look at the history of the church, you will find that the church became prominent when there were those diseases which were said to be infectious, so to say. Pandemics, those are what identified Christians. And those are the ones that, put Christians apart. I'm sure you know that COVID is not the first pandemic we've had. But in every pandemic, there is a mention of Christians, a group of people who dedicated themselves to looking after those people from whom everyone else was running away from. In the pandemic in the 4th century, they say that actually relatives were literally throwing their relatives out of their homes because there was no quarantine center. So there was no Levi Wanawasa to take your relatives to. So to remove them from the home, you just throw them in the street and leave them there to die. And it was the Christians who were going to get these people, some of them into their own homes. Some of them took them into hospices. And it was Christians who were identified as being the core among the carers. And when you see what exactly made Christ to do what he was doing, you will find that actually it was all coming from his heart. Matthew 9 talks about him. Can I have my next slide, please? Good. Matthew 9 talks about Jesus Christ preaching and healing. Then in verse 36, it comes to the point where he himself comes out and looks at the crowd. I know now when we look at the crowd, what do we look at? What are they wearing? Are they in party regalia or not? But Christ was looking at these people and seeing what their actual need was. And we are told that he was moved with compassion. And this ought to be the mind of every believer. I hope Prof. Goma has laid the foundation of us having that mindset that sets us to look at the real needs of the human beings who we meet, so to say. And that is the gist of the healthcare profession. This compassion. Christ looked at them and they looked weary and they looked scattered, like sheep without a shepherd, so to say. When we look at each other, what exactly is it that we see? And that is what ought to be the basis of our approach to healthcare even now. It was in those days. So from the early church, we could see that the church was actually looking after people. More so those who were poor, so to say. Because private health care has always been there, okay? You could always afford to get a good doctor to look after you. You could get expensive medicine from time immemorial. It was those who were poor who could not afford to get these people to attend to them. And that is where Christians were coming in. And so my first bullet there is, next slide, please. Sorry, I thought we were moving together. Okay. You could see that the Christians were not only looking after illnesses. No, they were looking after a whole person, so to say. And so those who were in need of food, give them some food. Okay? This was during one of the pandemics, when it was actually difficult to find some people to bury somebody. You had to pay expensive services to get anyone buried. But Christians were up to it. They not only gave food to the poor, not only gave care to those who were ill, but they actually buried them. Okay? And immediately they took up the issue of looking after orphans and widows. Okay? And then there were the elderly, those people who could not labor for a living. They had to look after them. And then we have the prisoners, we have slaves who were sick, and other outcasts, especially lepers. Okay? Now, I'm sure you know that in Zambia up to now, the major leprosy hospitals are mission hospitals. Mwami in Chipata and Mwandi in Western Province. Those were hospitals where lepers could go, because these other hospitals were not keen on handling such infectious disease, whose cure they were not very sure of in those days. But the believers took it upon themselves, and several people can testify that they actually benefited from what was going on in those hospitals. So apart from us approaching healthcare from the view of us giving medicines to the sick and making them well, we have to look at the issue of us having hearts that are generous and hearts that have compassion. This generosity is what brings me to the issue of salaries in the healthcare system. Many people shun health care because of the poor salaries, so to say. Oh no, doctors are very, very poor, okay? And so nurses, they are getting very little money. Oh, biomedical scientists, you don't even talk about them, you know? But really, is that all that will take us into a healthcare profession? The answer is no. Part of our generosity is that which makes us forfeit what we could have gotten had we not been who we are. Yes, we would have had better jobs by now. I should have been working for this body, getting so much money. For now, I am here, getting this much. But what you have to know is that much which you have forfeited is what you yourself is giving away. That is the heart of a Christian. That is the heart of a believer. And so our forefathers approached healthcare with that mind, saying that we need to care for the people the way Jesus himself would. We have to care for these patients the way Jesus himself would. And that, I think, must be the basis of our approach to healthcare and living within that healthcare system. I had to quote Osler here because Osler was a heart specialist. And I'm sure a lot of physicians remember Osler for all that he taught. But I think Kasondi has already said here that it was the Christians who established hospitals. It's also them who established schools where people could be taught. Nightingale established the first nursing school. Osler and his friends were teaching at medical schools. But you can see that what Osler is saying is that apart from knowledge that these doctors would obtain from their medical school, they needed to base their attitudes and care for the patients on biblical standards. That was the bottom line. So there was supposed to be a difference between a doctor and a Christian doctor. Okay? There was supposed to be a difference between a nurse and a Christian nurse. Between a biomedical scientist and a Christian biomedical scientist. There must be a difference. Why? What is that difference? It's the difference when it comes to values and setting those standards. Because our standards are supposed to be biblical standards and nothing else. And it was gratifying to note how Christianity has contributed to healthcare. In that our friends came in with real change in the way they looked at life, so to say. We hear so much about the preaching of John Wesley and George Whitefield. So many people came to know the Lord during their time. But what else did they do? They actually brought about the whole issue of hospitals. They needed to see that people were getting the care of the Jesus Christ that was being preached by the preachers of that time. So salvation was making them get rejuvenated in their energy towards doing good to other people. And I think you know that is one thing that someone has said about Calvinism, so to say. He said one thing that Calvinism brought about was the issue of who people have called the chosen frozen. Salvation and it alone. Don't look at your neighbor. Okay? Preach Christ. Preach Christ. Okay? And after you preach Christ, get into doctrine. Nothing else apart from that. I was saying, well, does this person really understand what Calvinism is about? But well, that is their outlook. to the whole life. That there are people who insist on scripture and doctrines of grace, but they really do not want to say that faith must be accompanied by works. So in moving towards biblical Christianity, we seem to be gravitating away from the social gospel. And yet, the point of judgment seems to be on works. I don't know if you have seen that. Okay? Whatever you did to the least of my brethren, that you did to me. What shall we stand up for? Did we see the people who were naked and clothed them? Did we see the people who were hungry and fed them? Did we see the people who had COVID and looked after them? All that really is what must be born in our minds. And so Christ did talk about us looking after the poor and looking after the needy, and this must be done practically. Okay? And let alone his last discourse with the Apostle John. Do you love me more than this? John says, Lord, you know. He says, well, tend my sheep. Tend my lambs. Was that really only spiritual? Or did he actually say that they must be fed well, both spiritually and physically? That was the understanding of our forefathers, that it had to be both. And so in preaching the gospel, you have to look at their other real physical needs. Tend my sheep. And really, from that revival came the new movement that was established in churches the world over. So you will hear of the London Mission Society and all these other societies which came into Zambia bringing the different hospitals. It was all because of believers there who took it upon themselves to actually get to the health needs of the societies in which they were going to preach. And so you find that in every mission station, you have a school, you have the mission itself, and then you also have a hospital. And that must continue up to now. That must continue going forward. We need to look after the sick, but the difference between the Christian doctor and the ordinary doctor is, as I said, the Christian doctor focuses on the poor, those who cannot pay for very expensive services. How do we make healthcare affordable? How do we make healthcare accessible? It's all by sacrifice. Either we put in money to buy those expensive services, or we ourselves have to give ourselves to it, that others may benefit from our care. And so, after that revival period, the hospitals were born in many places, and as I said, after this revival, then we also had the benefits of a lot more people coming into Zambia and setting up hospitals. And the last bullet, I was just looking there at our responses to pandemics, that actually it's not the first time that, a pandemic has happened and hospitals have closed. But I'm sure COVID-19 is still on our minds. Chirenje, first level, has closed. UTH, all the clinics have closed because of COVID. But what happened during the last pandemic they had in the UK? People, actually Christians, rose to the occasion. They are the ones who kept their hospitals open to treat cholera patients. There are hospitals which were remaining open to look after the people who suffered from the Spanish flu. Okay? And why was that so for them? It was all because of this thing called Christian compassion. Christian compassion. It's not something that can be taught, and it's not something that can be demanded of a person, okay? But it's something that can be born in a person by conversion. I just wanted to say something about nursing, because every time we talk about healthcare and the doctor is speaking, he always speaks about it being doctors, doctors, doctors. But no, I think nursing is another profession that has had its roots very clear within the biblical spheres, okay? And Prof. Bowa talked about Florence Nightingale. I think she's just seen to be the one who brought so much light to nursing profession. But I think the thing about Nightingale was that she went further to bring in this whole issue of night duty, so to say, okay? Meaning that there are patients who need 24-hour care, okay? And it's something that is very, very difficult to do. I think the nurses here will appreciate. Night duty is not a very easy thing to do. And if you want to see temperate nurses, visit them at night, okay? Tempers are very high, okay? But I remember, Professor Nkanduluo, when she was Minister of Health, visiting one of the hospitals, and she found the nurses sleeping. So she went and knocked, and these nurses answered her very rudely, So when she came to tell us the story, they said, "But Minister, what were you expecting? There were no patients in the hospital at that night. So could the nurses be sleeping?" But anyway, it was all the issue of care, that what is needed mostly is not only the medicines. You see, doctors, the thing that we are good at doing is prescribing. Okay, you have malaria, here's Coartem. Go and die at home. Okay? But that person does not only need your Coartem, that person needs other issues around him to make him recover, isn't it? And so it was that holistic approach that Nightingale brought to bear. Okay? That is what Nightingale brought to bear. You can imagine the issue of this patient I was talking about, who we discharged from St. John's. Okay? Proper nursing requires that by the time we went to take him out from there, the nurses should already have had information about him. Where does he come from? Who are his closest carers? How does he survive beyond here? Does he even have a blanket that he's going to use when he's at home? Okay? Because when he's in the hospital, it's all this nice linen around him. Okay? And all these people who look after him, and 24 hours. Okay? But we get him from here to home, what is going to happen to this person? Okay? And those tenets are what are still obtaining now. That is why our friends now are having not only hospitals, but they also have what we call midway homes. Okay? You discharge him from medical care, so to say. The doctors have finished giving him their tablets and their injections and their operations. They are finished. But this guy cannot survive in his house. Okay? Because, he uses a pit latrine which is outside, and it needs a lot of logistics to take him from his bed to the pit latrine outside. Is there a way in which we can keep him in a safe place? In a place where he can easily access these services before he goes to his house? Who looks after him in those places? It's not really doctors. No, he doesn't need doctors anymore. It's the nurses. But does he need these trained nurses? The answer is no. All he needs is someone who has a heart to care. And that is why Mother Teresa is running. Okay? These nuns, no training, but they are giving care to those people. And thank God, several of them get discharged from there. They go back into their communities and become very, very useful citizens. And then Elizabeth Fry is not talked about so much, okay? But I wanted to bring out the issue here of Elizabeth Fry, because her observed the working of non-Catholic believers. Okay? These were Protestant nurses, so to say. But they were really not trained nurses at all. People who had just a heart to do some work. And so they called them deaconesses. Okay? Can we have deaconesses coming out of here? Okay? I know that when you go about deaconesses, you are talking of people who have very nice hearts. And I think that is why when I was deacon at Lusaka Baptist Church, I wanted to put myself aside. I said, I'm deacon in charge of excommunications. So that they know that, this guy doesn't have a very nice heart. Okay? So, but deaconesses, I think these ones are supposed to have hearts of those Catholic nuns. Okay? For them, I think they are trained somehow to have that heart. But no, I think this heart is supposed to be found in every believer. I remember, working with one nurse in UTH. Times when I was very, very stressed and going to theater, I would find her, walking around theater. And when I just seeing her made me feel a bit calm. Well, it's not as bad as I think. Things will be well. Just by her demeanor, just the way she presented herself. And when you spoke to her, she would actually give you that Christian hope. No. What you are doing is a fantastic job, and what you want is all going to be provided. So, we're going to theater, I have 16 women to look after, and they tell me there are only 9 sets. Okay, how do you do 16 operations with only 9 sets? If you find her, they'll say, no, don't worry. And surely you go there, you find this one doesn't need to use your set, this one doesn't need to use it. And then at the end you're finished doing all your operations and you still have 1 set remaining for just someone who may need it most. Okay? But that is what a Christian hospital is supposed to be like. Full of people who have hearts that are given to caring. And when you meet together, you are all in one accord. Yes, we are doing it. And definitely, God sees these things. Whatever you did to the least of these, my brethren, you did to me. And then comes the issue of specialized medicine. And here I want to bring in our other professionals, the biomedical scientists, the physiotherapists, the social workers, and everyone else. That you see, the need for specialization was actually born out of Christian churches. It was Christians who actually said it's high time we started specializing. One person cannot do everything. So can we please have physiotherapists attending to this person beyond us? Can we have biomedical scientists, doing our laboratory tests? Can we have gynecologists to attend to these problems and surgeons to attend to these problems? And so it was. Actually, you will know that, when the secular world picked up the issue of specialization, it was not very kind. Okay? There was a lot of territorial wars between physicians and surgeons. I think it was on the nose. That is why surgeons, we stopped calling them doctors. Okay? So I like him. I'm sure he's smiling here. He's supposed to be Mr. Boa. Okay? He's a surgeon. Among us physicians, he's not worthy to stand among us. Okay? Because we don't believe in cutting people up. We don't believe in using the knives and chisels. No. Okay? These guys are surgeons, so they go back into the lay world. Okay? So Mr. Boa, Mrs. So-and-so, those are surgeons. But that was secular world picking it up. But Christians are the ones who were behind specialization in medicine. That's what I would want to say. So then, we would say that Christianity does give men new perspectives, and it's a duty they do with a lot of allegiance. They know that they are not doing it as unto man, but doing it as unto God. And they work in these hospitals joyfully. Okay? Theirs is supposed to be a joyful and grateful service for God. Because it's Him who has saved them, and it's Him who has placed them in that place to do works for Him. going forward. And so when you are within the medical sector, you know that you are given a unique opportunity, really, to express your faith. It's a unique opportunity to express your faith. And so that is why we are saying that it's a difference between a Christian health worker and a non-Christian health worker. A non-Christian health worker is there because he wants his pay. Okay? And it's government which pays him. And someone told me last time, but why are you not working? He says, the government is pretending to pay us. We are also pretending to work. But that's typical of the world. Okay? Christians have to know that their salary comes from elsewhere. And so they labor to please him who has sent them to do that job. And they know that they are there. It's an opportunity to serve. And so that brings in the whole essence of health care. And I hope we can have our children taught to think this way, to really relate to the healthcare ministry this way, so that we can have more Christians going into this service. I mean, it breaks my heart to see so many people training as nurses. They are not converted. So many training as doctors. They are not converted. And really, it's dangerous to train such people. Very, very dangerous to train such people. Because we will have a lot more work to do to try and control their practices. We will have a lot more work to try and regulate their practice. Christians are an easier bunch to look after. With time, the Christians came together and formed what is called the Christian Medical Fellowship. And the Christian Medical Fellowship has tried to bring believers together, really to try and make them appreciate their call to the health sector from the time they are students, really. And so that is why it's urgent that you preach the word to the teenagers, so that when they come into medical school, they are already believers. I'm sure Mrs. Mbewe still remembers how nice it was to have a nice Christian fellowship with these people who had already, who were Christians and came into the nursing school, and you meet together, you can see that, yes, this is the way to go, okay? And as Christian Medical Fellowship, I think was a fantastic thing to have, okay? And from there, you try and build up the tenets of Christian faith in these people. You want to deepen their faith. You want them to know that they ought to live like Christ, to serve him obediently, and they ought to do that by acting competently and with compassion in their clinical practice. So you start indoctrinating them in good clinical practices while they are students. But when you become doctors, you ought to live as good examples to the students. And so the Christian Medical Fellowship has this link between older health workers and younger health workers, that they ought to move towards clinical excellence. They ought to act competently, but with compassion. And the Christian Medical Fellowship still insists on evangelism, okay? And it also insists on missions and on these believers having the Christian, holding on to the Christian values. But among the Christian values is the issue here of bioethics, okay? Bioethics. This is one issue which again differentiates Christians from non-Christians. We are battling with a lot of ethical issues there, okay? And most our non-Christian friends may call them dilemmas, okay? But some of the issues are really issues that must get to the core of our calling, okay? We have the issue of abortions, okay? Abortions. We have our non-Christian friends, they have no problem with it at all. And on the other side, we have the church, which says, thou shalt not kill, okay? But now, even among the people we call the churches, you can see that there are those who are on the extreme, saying no abortions, but there are those in the middle saying, probably, there are some circumstances. Where are we supposed to be? The whole point is the whole issue of compassion and having a very high regard for the sanctity of life. You find that those dilemmas actually pity off. There's not much argument about it because it's very, very clear to a Christian which way he must go. And so I just wanted to give a little rundown of when the Christian churches started operating in Africa, in Zambia, really. The oldest mission station that I found was Mwandi, okay? Mwandi Mission Hospital, established in 1884 as a dispensary. Now the dispensary was like a general practitioner's office, okay? You go to see the health worker there, they give you medicines, you go home, okay? They call those dispensaries. So Mwandi Mission, 1884, that's when the missionaries came and established the hospital there. And since then, it has been going through an amount of renovations, but it's still there to show us reason why we ought to continue to look after the sick. I was actually rebuked when I went to America, and I visited Brody School of Medicine, okay, in East Carolina, okay? And I find there a doctor who says, "Oh yeah, you're from Zambia. Have you been to Mwandi?" And I said, "No." I said, "Well, I go to Mwandi every year, and every time I go there, there are so many people who are in need of surgical care. And so I take my team with me. We spend a week there. We do so many operations. Last time we spent 2 weeks there. We did so much, okay? And here I am as a Zambian doctor. I've really never taken time to go and see what's going on in Mwandi and to see what help I might give to them, okay? And last time, I think, then the guys in America got in touch with the guys at the UCZ mission in Zambia and said, "Yeah, we know some Zambian doctor there who should be able to help get our people to Mwandi." And that's Dr. Goma at the medical school. So the person here came and told me, "Oh yeah, we are having doctors coming from America and the Ministry of Health is putting in some spanners. Can you help them get to Mwandi?" And I was wondering, well, how do we do it? How do we do it? But nevertheless, I mean, we did it. The Ministry of Health started demanding that when doctors come to Zambia, they should pay 15,000 kwacha's practicing fee. And there were 10 of them coming. So the church was supposed to spend 150,000 kwacha just on licenses, So, I mean, we tried to talk to Health Professions Council. It wasn't working. So I told this lady, "Okay, just take this matter straight to the minister." Okay? And she did just that. She said, "I'm going there." She went there, talked to the minister. Minister said everything quashed. They come in free of charge. And they came in and they went to Mwandi to go and do some work. Okay? But really, the Zambian doctors are doing very, very little to try and target certain portions of our communities where our help may be needed. So probably it's time we started talking together, okay? Where can we be of help and how can we be of help? Together, I think we can do a lot more work. The next hospital that I was putting out was this hospital from the land where Prof. Boas' relatives don't even know how to mention the name of their own place. We call it Mbereshi. They call it? They know these people don't have she, okay? They only have C. Kumberes. The Nangumbos. Okay. So then just put down a list of other clinics under UCZ. And then next slide is just saying that there are many other congregations which are Christian in nature. They all total 16 in Zambia. These ones have all been gathered under the Churches Health Association of Zambia. And Churches Health Association of Zambia, as I said, is just a gathering of these 16 congregations. It was founded in 1970 as the Churches Medical Association, but you can see why the name was changed, because medical really most of the time relates to medicine as in Doctors Association. And so it was all changed now. It says Churches Health Association of Zambia to show its larger mandate. They have a vision that they want to see a Zambian society where all people are healthy and live productive lives to the glory of God. And the mission is committed to serving the poor and underdeserved communities with holistic, quality, and affordable health services that reflect Christian values while meeting stakeholders' expectations. But you can see that in their mission, they have maintained the essence of healthcare, okay? That it must reflect Christian values. But at the same time, they are still making it clear that our mandate is to reach out to those who cannot pay for their health services. We must reach out to those who are in need, in real need, and poor and underdeserved. And I think the Churches Health Association is doing quite well as it is now, okay? Because it has 151 member health institutions. It's providing half the health care needed in Zambia. 50% of rural, of health care in the rural areas. And that's huge if you know how much budget the Ministry of Health has for health care in Zambia. For the Churches Health Association to take half of that burden in rural areas, it's really commendable. If they were not there, the services would not be there, okay? I know that, at least for now, my village has, a clinic within a kilometer of my parents' home because of Churches Health Association. The Catholics have built a clinic there. Before that, we had to go 8 kilometers to seek help from the clinic, which was nearest my school. And so you can see how much distance we had to travel. But now the Churches Health Association has brought in this clinic, but it's really a rural area. And so not many people are willing to go there. Actually, when you have a person who does not have a heart for the people, 3/4 of the time they are out of station. No, she has gone to a seminar this side. No, she has gone to Chama to do something. No, she has gone, saying, but the clinic is there, but no healthcare worker. Okay? Just because the person does not have a heart for serving the community. That is where Christians come in. We would want to have people who are settled in their hearts. I'm here serving this community. I cannot go for a useless seminar. Okay? I can actually send someone to go and do something else in the Goma or something like that. But really, we can make a difference. So you can see how many hospitals there are and how many health centers there are. So then, this is my last slide, really. How has the church been the light in the health care? Well, if we keep it broad, we will say that the example of the Churches Health Association of Zambia is a fantastic example of what the church can do to be a light in the healthcare system. In that we have gone out not to give any inferior healthcare, but we've gone out to give quality healthcare. And we want to give affordable healthcare, and we want to give people access to healthcare. So the church has tried to offer that. Okay? The church has tried to offer that, but we still have a long way to go. Okay? If you ask me in my personal experiences, I was running St. John's for some years, and I had at one time 64 nurses at St. John's. How many of those were from the Baptist church? You can take a guess. In the 9 years, I had only 2 nurses from the Baptist church. And so you had to bring in, watchtowers. We had to bring in, SDAs. We had to bring in non-believers. Because what we needed were nurses. But is the Christian church empty of people who have hearts for caring? I think we need to think seriously. So probably it's time that the church took this as a primary concern. Because if we don't have people who have hearts for health care, then you have to try and ask, do they have the mind of Christ? Do they have the heart of Christ? Or do they just care for themselves? And all they are doing now is just trying to survive, waiting for heaven. We need to be earthly minded when it comes to healthcare. There's work to be done, and that is the work that is going to be judged ultimately. I think if we had that mind, we may probably fare better. All I'm saying here is that laborers are still very few in this field. We need people to go out, to tend to people's bodies, not only to look after their souls. And whatever we do, we may have Christian nursing schools, we may have Christian medical schools. We cannot train person into Christianity. They need to be converted. For now, I really think that we need to keep praying that believers get persuaded to participate more and more in healthcare provision. May God grant us that grace. Thank you very much.
Good afternoon. Thank you so much for that talk, Professor. A huge inspiration, and as someone who's been taught by you, I can testify to everyone here that he definitely walks the talk when it comes to passion for his work. So my question to you is just, what word would you have for young people who are in medical training currently and are faced with the frustrations that I think are quite evident? I don't know how much things have changed or stayed the same since you were in medical school and had to enter the health sector. But I think one thing I can say is many people are looking for a way out because of all the things, just the frustrations that come with dealing with the public health system, all the things that are lacking in hospitals. There's very little to encourage us to continue in this field. So what do you have to say to us?
Well, I think that was the base of my talk, that you guys must set new parameters for satisfaction, both with your training and also with the practice. What is it that we are intending to do, and how well can we do it? And so the frustrations that you may be talking about are just temporal, so to say. They are just because of what is current, so to say. And in my view, I would say that they are very economical, very physical, so to say. But as a believer, what must be in the fore is what is on your heart. And that is what must keep you driven, so to say. And then you need to set your parameters of success, parameters of happiness within what is described in Scripture, so to say. And so Training, yes, there's a lot of issues around, but as a believer, you have to make an extra. You have to take an extra. You have to put in extra effort to try and get to where you need to get. Somebody was telling me at one time that no, see, we don't go to theater because when we get to theater, there are so many of us there that you can't even see what the surgeons are doing. Okay? I said, well, yeah, it's true. But have you tried going there at night? Okay? Because the surgeons are still operating at night. Okay? And so, as a believer, you need to take that extra step that is required in the training to make sure you get what you want. And so, find these surgeons when they are operating, where they are operating, and be there. Learn to do those things which you are supposed to have learned. Then you get into the field. Yes, the main issues there are money. But no, that should not be your parameter for measuring your happiness. Your happiness should be how much you have done for your patients. And I can assure you, you find that the money you earn is more than enough. Okay? The money you earn is more than enough. Okay? And that will keep you going. I can assure you, medical practice is a very, very satisfying practice if your measure of success is seeing people getting help in time of their need, and that help has come from your hands. And so you are in the right field, and as medical students, we hope that us who are ahead of you are giving you a good example of what it means to be a health worker, and that we ourselves are showing you that we are happy where we are. Okay? If we are being bad examples, you must forgive us. Okay? But I think in every way, we are trying to show that this is the way to go. Okay? So the Christian Medical Fellowship has been there to try and bridge this gap, as we are saying. And Kasonde would still remember our old mentor, Dr. Jim Jewell, the man who was in the Luampa mission for many years. He would come 4 or 5 months in Zambia, working there. And the goodness with him is that, this man had a heart that was grateful for many things, okay? Him even just, giving him a bed where to sleep, he would be so thankful. Oh, thank God. This is so great. I said, Jim, but what is so great about this bed? But really, you have to lower your expectations and be ready for work. That will keep you happy, always within the medical field.
Yes, thank you, Professor, for your presentation again. And maybe she spoke about how practical a person you are. Just maybe on a lighter note, I remember when you were chairperson, I think at Unzamet here, University of Zambia, you had the medical school of the fellowship, and you had a prayer meeting, and one student said he had a headache, and you said, "Now let's be serious, give him Panadol. Let's have serious prayer requests." But that's how practical Professor Goma is. But my question is to you and Wilbrod, I think, Dr. Mtale, because you mentioned that you ran St. John's. I wonder if you're still you're probably not in the management, but maybe you're in the background. But you're running for quite a few years, and Wilbrod is running his own, together with some friends. In his bio, he's the CEO of Teledoctor. So I wonder if you run it as kind of a Christian institution, or you run it as a Christian who's running a medical institution. So there's a bit of a difference there. Whichever way you did you have opportunity to have training deliberate training or discussions or topics around the philosophy of healthcare, or just compassion or whatever, or was it just everyday work that carried on, and then maybe you dealt with individual case-by-case basis? If somebody who's a Jehovah's Witness is not doing well in healthcare, you call them into your office to kind of discipline them or what? Or did you have deliberate arrangements? And if you did, what were they fashioned like? Similarly for Dr. Mtale, do you run it? I know that probably most of you who are in management are Christians, if not all of you. And if you do, is this a Christian institution deliberately, or are you running it as Christians who are running an institution? And there's nothing wrong with either of the two. And if you do you have a deliberate philosophy where you train the doctors that you do, for example, the people that you have on your list across the country who are doing teledoctor? Is there deliberate training or philosophy towards this, what Professor Goma has been saying about this ethos, this philosophy toward healthcare that is one of sacrifice and service to man, but primarily because it's service to God? Thank you.
Thank you very, very much. I think that question is loaded, and I hope that the others who are here have actually seen the approach that you are taking to healthcare provision. Really, our intention in setting up St. John's was to have a Christian medical center. That is why we named it St. John's. Okay, it's named after the Apostle John. We all know that he's the apostle of love. So we were saying that, if we can't do anything else for a patient who comes here, one thing that they must get from us is love, the love of Christ. And so even our motto was caring for you and your family. Okay? Looking at the whole span of patient care. But did we manage to do that? The answer is no. We have ended up running it as Christians who are running a healthcare system. And the reasons were really all based on the density of the doctors and the nurses and the biomedical scientists that we had in the hospital. We had, I think, just among our whole list of doctors, I think we had probably a quarter of the doctors were Christian. The nurses, as I said, there were even a smaller number who were really Christian. And then we got into the system at a time when it was very busy. And so all of us concentrated on healthcare. And we didn't take time to actually inculcate this ethos of our Christian beliefs. And so all we were doing was just giving people an orientation, okay? We would take time to give I would call it just an orientation, just to remind the people of who we were as a medical center, that we are a Christian medical center. So once you're at St. John's, know that there are certain things we do, there are certain things we don't do. And of these things that we do them well. Okay? We do them well. And here, we believe in caring for the patients. So I remember at one time, running out of oxygen, and one person said, "Can we take this person to UTH?" I said, well, we will not do very well to take this person to UTH now, okay? Because I know the problems that are going to be there. By the time he gets to an oxygen point, the man will be dead. We are St. John's. We have solutions to everything, okay? And it became a password after that, because what I did was what they thought was impossible in private sector, to go and borrow an oxygen cylinder from your friends. But all the members that I used to say, don't buy what you can borrow, okay? So I drove to Hilltop, and said, I need a gas cylinder. I said, no, but we have never lent anybody a gas cylinder. I said, yeah, you are doing it for the first time. We are St. John's, okay? And they gave me the gas cylinder. When we took it back, they said, well, you guys seem to be very different from the others. I said, well, that's what we are. We needed to care for that person. And so whatever it takes, we'll break our backs to get a service in. But really the approach you have mentioned is an approach that must be taken. If you have a Christian hospital, you ought to constantly train. You ought to constantly, build this Christian base. It must always be built because there's so much traffic among the people you have. Okay? Today you have this list of nurses. The following month they have gone somewhere. You have another new list of nurses coming in. But whoever comes in must get into gear on arrival. That's the way you run a Christian institution. And we could not get there with St. John's. But we are hoping that, we can get there. Looking at the other hospitals, I think the only people who seemed to have been getting there are SDAs. Because the SDAs have a particular training curriculum that already puts in Christian courses. So like if you go to an SDA training college, there are 12 courses which you must take in Christianity. Okay? They call it Christian beliefs. Okay? But every year there's something that they are teaching the student nurses or student doctors, okay, about Christian ethos and things like that. So they come out of their colleges already with this orientation. And they were very, very particular at one time in employing. They would only employ SDAs just to make sure that, they didn't have much work to do outside their doctrine. But the other churches have been rather loose. As for our Catholic friends, they are just loose. Either you are Catholic or you are non-Catholic, they don't care. Okay? But they have to make sure that, you have these people in uniform, and those ones in uniform are actually all into it full time. And so it's very easy. I mean, like, the way Mother Teresa Hospice is run, it's amazing, Because, these 7 nuns have, I think, these 4 wards to look after. Do they look after them themselves? No. They have the whole Catholic community there participating in looking after the place. Some are doing gardening outside, some are doing, tailoring inside there. So they do their own linen. Then the people who come to clean the place are also just volunteers. They just come from the community, they clean the place. When you go there, the place is smarter than UTH, which has so many employees. All because people give themselves to that ethos which they have been training together with the caregivers. And I hope we can get there. Let me now stop here. And could I answer them together with Dr. Mutale? Because I really think that, we'll keep talking and talking and talking, and then everyone will be too tired to listen to him. So let him present his part, then we can talk. I can answer my questions during his question and answer time. Chair, please.
Thank you very much, Professor Goma, for that very interesting talk. So hold on to your questions. As we have agreed, we are going to answer them together when Dr. Mutale finishes his presentation. But I think it's still important for us to take just a short break, perhaps 5 minutes, to check your emails, answer calls, and call back people who are trying to reach you, and then we can come back when we switch our minds as well to the next topic. So he is going to be talking about what we can learn from the abuse of this area or healthcare, and some lessons that we can apply or actions that we can take for ourselves to change the narrative. So let's take a 5-minute break, 6 minutes actually, up to 12:35. He's doing the last presentation, and then we'll have the final question and answer, and we'll be done. Thank you so much.